cell is not oxidized by free radicals, which is, you know, an oxygen atom that's missing an electron. See, an atom, a normal atom that's stable, has 2 electrons orbiting around. And Dr. Morton mentioned about when women go to the bathroom, they go in pairs, right? They go in pairs. But a free radical is similar to a newly divorced male that's chasing women to stabilize himself. I know that because I was once a free radical. So in these studies, they found that the mangosteen xanthan is potent antioxidant. That means antioxidant, one substance that could donate an electron to stabilize that free radical, so it's no longer damaging to the cells, because this free radicals can attack the cells, the DNA, causing mutation, and the LDL, and so on and so forth, and causing aging. So it's very powerful. In 1996, they found it also to be effective in methicillin-resistant staph aureus. And right now, it used to be that, we call it MRSA, used to be only found on debilitated patient, nursing patient. But nowadays, recently, you can also find them in healthy patients, healthy people. As a matter of fact, in England, they found in children that are 2 years old, they're getting infected by MRSA organism. And in this study, they found that the mangosteen xanthan is effective by itself in dealing with methicillin-resistant staph. Okay. In 1996, this study, they found that it is also effective in blocking the protease 1 enzyme of the AIDS virus. This is laboratory studies, you know, it's not a human study, because most of this research I'm mentioning are scientific studies in vitro or in vivo, because substances has to go through 3 different processes of investigation. And number 1 in petri dish and test tube, number 2 in animal studies, and number 3 in human double-blind studies. Correct? And if a drug is maybe 60 or 50% effective and 30% safe, then it could be approved. Right? Don't tell that to anyone. See if you can record it. Okay. Now, there are drugs that have the same mechanism of action as the mangosteen xanthan on AIDS virus. I'm not saying that this is a cure for AIDS virus. I'm just saying that the findings that they have, that it blocks the protease enzyme 1, which is required by the AIDS virus to mature and replicate so that it becomes infective. But if it doesn't, then it doesn't become infective. So just remember that. 1996, they also found it to be a histamine, antihistaminic for allergy, and also blocks the serotonin blocking properties to make us calm, you know, like the drug Xanax or Zoloft is for for depression, or Paxil. So usually I recommend to the ladies in the audience that if their husband comes home grouchy, just give them half a glass of mangosteen juice. And you can control him like a baby. How many billions of dollars have been spent by researchers to find a drug that is safe for pain and yet effective? I heard from Bob that right now the pain industry, drug for pain industry is about $7 billion. And it's going to be about $9 billion by the year, in a couple of years. So with Voyage and Vextra getting out of the market, there's a void there. There's a lot of people suffering. But they found that the gamma-mangosteen xanthone is effective in selective, specifically blocking the COX-2. And I'm going to explain that. Here's a study by Nakatani, too long ago, published at the Molecular Pharmacology in June and September of last year. And it's explained here that if there is an injury to the tissue, the cell membrane will secrete a substance called arachidonic acid. And arachidonic acid is acted upon by two enzymes, the COX-1, which is cyclooxygenase 1, and COX-2, which is cyclooxygenase 2. Now, the COX-1 produces basal prostaglandin, which is beneficial to our kidney function. It protects our stomach lining. It also protects our clotting mechanism, and also enhances neurotransmitter release for calming effect. So that, gentlemen, if your wife are grouchy, give them a glass of mangosteen juice. More than... I'm just kidding, okay? It also, basal prostaglandin also has immune modulating property. So that is something that we don't want to block, right? However, the COX-2, cyclooxygenase 2, produces prostaglandin PGE2, which is the one that causes pain, inflammation, redness, swelling, so and kidney problem, So we want to block that one, because how many people do you know that have pain, chronic pain? Isn't it? And if we can help them, it's tremendous. Unfortunately, the study shows that the drugs that we're using, which is called NSAID, which is non-steroidal anti-inflammatory drugs, like aspirin, like ibuprofen, like naproxen, blocks both COX-1 and COX-2. And we don't want that to happen, because now we don't have there's kidney damage, there's bleeding problems, and there's ulcer formation, gastric mucosa, and messes the immune, and we get so nervous and anxious and all these things, correct? So what we want to do is we just want to block that COX-2, preventing the production of prostaglandin PGE2, which is the one that causes pain. And gamma-mangosteen xanthone, actually they found to also block the gene that expresses COX-2, cyclooxygenase 2. So we spare the basal prostaglandin, the beneficial prostaglandin, while we block the one that causes a lot of problems. Isn't that amazing? I don't know of any drug that does that. And mangosteen juice is the only natural juice that does that. Selectively blocking the COX-2. And this is a quote from Nakatani, the one that really has been researching the mangosteen xanthone for the last 10 years. It says, quote, "These findings thus suggest that gamma-mangosteen xanthone serves as not only a new attractive pharmacological tool for studying of the molecular mechanism underlying inflammation, but also as a new lead compound to drug development for prevention and treatment of inflammation." That's something, that is the mechanism. So now, there are 4 major cancers that kills us. Got lung, we got prostate, breast, and colon. And they haven't really found the real cure for those cancers unless they're diagnosed early. But advanced, they haven't. And in this study, several years ago, in Taipei University, they extracted one of the xanthone, garcinon E, because primary liver cancer is actually common over there. So they try to find some herbal products that might address that. And they found that the garcinon E has some cytotoxic effect on the hepatocellular